Thank you, everyone. It's very exciting to be here. I am a neuropsychologist. I'm currently at Rutgers. I used to be a Mass General a month ago. I have no conflicts of interest associated with the study, and these are our funding sources for the clinical trial. So you've all done a really wonderful job, really highlighting how heterogeneous the clinical presentation of long COVID is. And neurological symptoms, including brain fog, are among the most common symptoms reported by people with long COVID, as well as very limiting. It really interferes with their quality of life and inability to go ahead and do their daily activities. And the underlying mechanism, we spoke a lot about this yesterday. There may be different mechanisms underlying these symptoms. These are some of them. There are more. And yesterday we spoke a lot about mitochondrial dysfunction, metabolic dysfunction, and so on. So we actually designed this clinical trial in 2020, and we started recruiting people in 2021. And at the time, we knew that coronaviruses could disrupt the NAD+ metabolome. And NAD+ is a coenzyme that's found in every cell in the body. It's involved in cellular metabolism, immune regulation, inflammation control. It also regulates essential metabolic pathways, such as the Krebs cycle. And more recently, we have seen more research showing that in the acute stage of infection, it seems like SARS-CoV-2 can dysregulate the NAD+ dependent pathways, probably because it activates PARP family genes, and that can increase the consumption of NAD+ and therefore lead to depletion. And there's a recent study that actually showed that there were lower levels of NAD+ compared to in people with COVID-19 compared to people who were not infected. And there were also altered levels of NAD+ metabolites, and this was done in people hospitalized with COVID-19 patients. Now, we can increase NAD+ by using nicotinamide riboside. It's a form of vitamin 3. It's a precursor to NAD+. And a lot of animal studies, or preclinical studies, has shown that when you use NR to increase NAD+ levels, it improves mitochondrial activity, reduces inflammation. It's also shown to have some effects on Alzheimer's disease pathology and cognition. And there are also some human studies that support a lot of the findings in preclinical studies. The other thing is that NR is safe, it's well tolerated, and it's available as a dietary supplement. So based on all of this, even though we didn't know a whole lot about long COVID in 2021, we did know about NAD, other coronaviruses, and we hypothesized that if we increase NAD+ levels using NR, we would be able to see some cognitive improvement in brain fog, as well as other common symptoms of long COVID. So we conducted an investigator-initiated clinical trial. Looking at this, our primary outcome was cognitive functioning. Our secondary outcomes were other symptoms of long COVID, and I'll show you a little bit exactly what measures we used. This was a 24-week, double-blind, placebo-controlled trial with a placebo lead-in phase. Participants were taking 1,000 milligrams of NR twice a day. And people who received a placebo, they were identical to NR. They were provided by Chromadex. And we were all blinded. It was the clinical trial pharmacy who did the randomization. And this was conducted at Mass General and here in Boston. So this is the procedure. Everyone started on placebo for 2 weeks. Then we collected baseline. At baseline, people were then randomized to either the NR group. The NR group just started immediately taking NR, and they took NR for 20 weeks. Then the placebo group continued in placebo, and then they switched. After 10 weeks, they switched to NR for 10 more weeks. And so we collected cognitive testing, blood, and all these measures at these 3 time points, but we actually collected blood for NAD+ at every single visit. I'm not going to go through all of these, but I do want to highlight that none of our participants were hospitalized or in the ICU. They were between the ages of 18 and 65. Inclusion criteria is that they must have been experiencing brain fog and at least 2 other symptoms that started around the time of COVID-19 infection and they must have been infected at least 2 months prior to enrollment. We measured NAD in blood. Our primary outcomes were cognitive testing, the R-bands and troublemaking B, and we also had a self-report measure of cognitive decline, of subjective cognitive decline. And the question was compared to before infection, have you noticed a decline in your ability to find words, etc. These are our secondary outcomes. So we looked at fatigue, sleep quality, anxiety, depression. We also have data on spirometer, dynamometer, and others that I won't be talking about today. So a few things before I get into the results. Because of the design of our trial, we're able to look at the data in different ways. So we can look at 10 weeks of NR versus 10 weeks of placebo. We can look, so that's between group differences. We can look at within group differences, so placebo versus NR in this group. And then we did some post hoc exploratory analyses where we bumped together everyone who took NR for 10 weeks and looked at change from baseline compared to placebo. These are all the symptoms that people were reporting. As you can see, everyone was reporting fatigue, of course, brain fog, and a lot of neurological symptoms. People were reporting at baseline pretty significant. These are compared to people who fully recovered from COVID-19. A lot of anxiety, symptoms of anxiety, depression, fatigue, and poor sleep quality. We screened 95 people. I'm not going to go over the whole thing, but we had 37 people in the NR group and 21 in the placebo group who completed baseline. Unfortunately, we ended with 18 people in each group because we had to exclude a lot of people due to COVID-19 reinfection and some other reasons. Most of our participants were on average high 40s. We've been seeing this over and over across our studies here, mostly female. And pretty highly educated. So when we look at NAD, right, the first question is, can we actually increase NAD plus levels? Well, the answer is yes. If you look at the right, the blue are individuals that started in NR, so NR just went threefold. They increased threefold in this group. And then the placebo, it stayed low, and then it increased when they switched to NR. So we did our job with increasing NAD plus. When we look at primary and secondary outcomes, and we look at specifically at between group differences, we actually do not see any significant differences in changes in cognition, sleep fatigue, or mood. And when we look at within group differences, we also do not see any differences. However, with our post hoc exploratory analyses, when we increase our sample size by putting everyone who took NR for 10 weeks together, we do see that these individuals are performing better in the troublemaking test. This is a measure of task switching or executive functioning. They're actually performing about 8 seconds faster. This is the clinical significance. We can talk about that, but we did see statistically significant changes. We also saw changes in the placebo group in subjective cognitive decline. And I just want to make a quick note that these changes in their brain fog, I guess, was seen in both groups, NR and placebo. A lot of our participants would come to us and say, just thank you for believing I have long COVID. Thank you for trying to do something about this. And even at the end, they were still experiencing brain fog, even less. I just think this shows how important it is to pay attention and to validate and support these individuals. Then when we look at differences from baseline, we also see that individuals who were taking NR for 10 weeks actually reported less fatigue, improved sleep quality, and less symptoms of depression at the end, and we did not see this in the placebo group. Within the PSQI, we saw it specifically in sleep quality and duration. So in summary, NR was safe and effective at increasing NAD+. There were no statistically significant differences between NR and placebo, but when we do these post hoc exploratory analyses, we do see changes in fatigue, sleep, and depression 10 weeks after NR supplementation. But of course, we need more trials that are larger and more diverse. We're going to be looking at they all were Fitbit for 20 weeks, so we're going to be looking at changes in sleep and physical activity. Also, is it that those individuals are we lowering the levels of inflammation? May that be one explanation too in these individuals who report less fatigue. We have MRI pre and post, which we will be looking at. We also want to know, are these individuals taking other supplements that may be contributing to improvements? but most importantly, who are those individuals who are benefiting? Unfortunately, we have a small sample, so we won't be able to answer a lot of these questions, but hopefully with larger ones, we can look at who's actually really benefiting from increased NAD+. And so I want to thank all of our participants and my collaborators, my lab, the ACTRU, and my paper came out actually on Wednesday, so these results were published last week, and you can access the paper with this QR code. So thank you.